Hello everyone. Welcome back again to my YouTube channel. Today I have a very interesting case for you all, which is very common these days amongst us. I have all my colleagues today for my workshop also, and we all are fortunate to see such cases. This is a case of cardiac amyloidosis, which usually is underestimated, and we miss very oftenly this diagnosis because our eyes doesn't see what our mind doesn't know. So this lecture is made only to make everyone aware that we should keep our minds open just to focus on such cases which we can miss very easily. So amyloidosis we know is a fibril protein that gets deposited in various part of the body, and heart is one of the most common along with kidney. So in patients who give hints that they can have cardiac amyloidosis, in such patients we should not miss the diagnosis. What are these patients? These are renal failure patients like the one we have. Patients who come to you with sudden onset carpal tunnel syndrome of unexplained origin, patients who come to you with proteinuria, patients who come to you with a big tongue. So all these things tends to give us hints that the patient may have some problem related to their heart, and that can be cardiac amyloidosis, especially valvular heart disease, low flow, low gradient aortic stenosis. Whenever you get patients of low flow, low grade aortic stenosis, you should give a thought to cardiac amyloidosis. Patients also tend to have other disease, other symptoms that can give you hint. So let us directly go to the echocardiographic feature of this patient who is on regular hemodialysis, but accidentally we found that his heart became very thick, and then it gave us a clue that this could be cardiac amyloidosis. So let us come to the monitor and see what his heart is showing. आप आराम से सोए रहना, ठीक है? So I tried to do the echo of this patient, and I would like to show you. Just look at the cardiac chamber of the patient. You can easily see that his cardiac walls, the left ventricular wall, is more thickened than the normal. This can be seen in various conditions, but the peculiarity of hint that cardiac amyloidosis gives us is the sparkling, starry, shiny myocardium. This myocardium is not like the normal myocardium. This is shining like stars and whitish in color with a thick pericardium and some amount of fluid at the back of the left ventricle, which is again a supportive sign and indicates a poor prognosis for cardiac amyloidosis. Coming to his short axis view, see how much his heart is thickened, and we see that the pericardial fluid, the fluid around the heart is spreading a lot. Similarly, if we come to the valve of the patient, this is his aortic valve, and it is more shiny and more thick than what we can get in normal patients. So these are some of the clues, and one of the greater clues which is very common according to the American Heart Guideline also, we can measure the interatrial septum of the patient, and this is the interatrial septum. If the interatrial septal thickness goes more than 0.5, it again supports a diagnosis of cardiac amyloidosis. If we can see, this interatrial septum is 7.44, which is way more than what is actually commented in guidelines. Similarly, this is his mitral valve. Again, this is thickened and more whitish than normal. I would like to show you the 4-chamber view of this patient. If you can see, face as arqa. So if you can see, again the clue that this can be a restrictive cardiac disease, that is a disease that can lead to restrictive cardiac filling, that is amyloidosis, is biatrial enlargement. You see, both the atria are dilated, the right atria, the left atria, both of them are dilated. If I check his diastolic function of the left ventricle, obviously we are going to get some form of diastolic dysfunction. So this patient has, if you can see, a tall E wave and a very small A wave. So definitely his E by A ratio is going to be more than 2, and if I keep tissue Doppler on the heart of this patient, I will get a very small E wave and a very big E dash wave and a very big A dash wave. So again the ratio becomes more than 14, which itself is indicative that this patient will have grade 2 or more diastolic dysfunction. And as per the guidelines, amyloidosis is suspected when your diastolic dysfunction goes above grade 2. So these are some of the features that we got, and these are the 2D echocardiogram features. when I went ahead with a higher machine and I did the 2D strain of this patient, the 2D strain typically showed the cherry on top appearance that is classical for cardiac amyloidosis. So this is how you should suspect and you should diagnose, bringing your clinical acumen, bringing your advanced echocardiography into practice, and gives your good services to such people who can benefit and their lives can be saved, because you know the topic and you were able to take out that hidden disease out of the patient's body. So I hope you will henceforth keep an eye on such patients and keep diagnosing cardiac amyloidosis at frequent intervals. Thank you for your kind attention.